All right, welcome. If you are here for our STAW about strengthening connections, strategies, insights, and data for child injury prevention, then congratulations, you're in the right place. We're really excited to see everybody who's joined today. I'm Clare Grace Jones. I go by Clare Grace. I'm one of the staff that works on the Child Safety Learning Collaborative. So supporting the collaborative as a whole, a member of the Children's Safety Network team, and also lead the sudden unexpected infant death topic call. And just, we often take for granted that we think folks know sort of who we are and all these things that connect. So we started adding this slide at the beginning of the STAWs just to remind you that all of these fall under the broader umbrella of the Children's Safety Network. So not only do we support the Child Safety Learning Collaborative, and we're going to actually talk a little bit today about how, if you are not already part of it, you can become part of it very soon. We broadly offer training and technical assistance for folks that are looking for resources, looking for support around things. We also support the Children's Safety Now Alliance, which is an alliance of national folks that are all focused on children's safety that come together to collaborate to create resources, and we create and make available webinars and resources. Of course, we always want to acknowledge our funding sponsor and to remind folks that while HRSA is our funder, please do not take anything that we are saying to be construed as their official policy or opinion or position. This is my big thing. I really want to make sure that everyone feels engaged in the call today. The whole point of these calls is to bring you these cross-cutting topics and give all of you the opportunity to interact with some folks that are really immersed in this and thinking about it, and to connect with each other who are doing the work in the field to share what's working, to share what's challenging. So we really want you to think about how you can be engaged in today's call. Closed captioning can be viewed, if that's helpful to you, by clicking the button at the bottom of your screen. I'm going to, whenever possible, narrate what's going on the screen and what's going on in the chat, or Lauren or Jenny will help with what's in the chat, because sometimes when I'm sharing the screen, I can't see the chat. But we just want to make sure whatever format you're joining from, you're able to access all of the information. Follow-up materials such as recordings and handouts will be available after this, and we'll make sure that they meet or exceed all of the guidance. We absolutely want you to use the chat feature, put your questions, put your thoughts, put your experiences. Please also feel free to unmute and share those as well, but do stay muted when you're not speaking, just because it cuts down on background noise. As you saw, we are recording today's session, and it will be posted on the CSN website. We'd also love it, in addition to introducing yourself in the chat, if you would rename yourself up in like the participant menu. So you can either click your own name under people, or you can click the little three dots in the corner of your video, and it will let you rename yourself. We encourage you to put the abbreviation for your state there. So if you don't already connect with the other folks across your state, you can easily find each other. And also, in case someone is looking for you after the webinar, it will make it easier for them to find you, excuse me, to connect or collaborate. Excuse me. We asked during today's session that you focus on intentional presence, bring a curious stance, be partners in learning, honor that everyone is coming with different perspectives, experiences, and learning styles, and take care of yourself as needed. I'm going to mute for 1 second. Oh, sorry. I don't know what happened there. Briefly want to go through today's agenda. Jenny, will you briefly go through today's agenda before I get to the next slide?
Absolutely.
Thank you.
Good role modeling of taking care of yourself, Clare Grace. So today we've done our welcomes and introductions. We're going to introduce our speakers, and then we're going to launch into an overview of risk and protective factors, and then hear some examples from the field from some of our participants in the CSLC from Tennessee, and we'll end with questions, discussion, and closing. And I just want to emphasize that this is an engaging event, and so your microphones are left for your control. We'll mute them, as Clare Grace said, as needed, but we encourage you to unmute and ask questions throughout the day. Put your questions in the chat because we want to make sure we're addressing them as we move forward. Next slide.
Thank you so much. And actually, before we go to the next slide, thank you, Caitlin. We just want to launch a brief poll. We'd love to find out who is here in the room. And so if you will take just a minute to respond to our poll, that would be amazing. Great. And it looks like about half of the folks have responded. So I'm going to give it just one more minute. All right. Well, we've got, I would say, a solid majority of folks who were able to respond. So I think we could go ahead and end the poll. Thank you so much for taking a minute to do that. So I am really excited. We actually, as you heard from the agenda, have several presenters today that are going to be sharing from the depth of their experience, both doing this work, being immersed in this work. And so I'm going to introduce them a little closer to their actual content. So first, again, just wanted to let folks know I'm Clare Grace. I work on the Children's Safety Network and the Child Safety Learning Collaborative, and I have about 20 years of experience in working in prevention and public health. My background is in instructional design, but I am also really pleased to introduce you first to Natalie Wilkins. She's a health scientist and team lead at the Centers for Disease Control and Prevention's Division of Adolescent and School Health. We just call them CDC DASH. Her work has been, since joining the CDC in 2008, her work has focused primarily on promoting youth development through applied research and knowledge translation within the context of injury and violence prevention and adolescent health promotion. She's led numerous projects in collaboration with public health partners at the federal, state, and local levels to prevent child maltreatment, youth violence, suicide, and substance use, and to promote mental health and sexual health among young people. With a strong commitment to research and practice integration, Natalie's worked extensively on translating scientific findings into actionable resources, tools, and strategies for public health practitioners. She currently serves as the lead of CDC DASH's research, translation, and dissemination team. So we are so pleased to have Natalie here with us, and her and I are going to kind of focus on this next section here together. So today's webinar is really focused on risk and protective factors. And I think most of us that are on this call are probably already fairly familiar with this concept. The reason I put a picture of a scale here is when I'm talking about this with folks that maybe aren't as familiar with public health, you're talking to parents, you're talking about schools, you're talking to other folks. We talk about risk factors as being associated with a higher likelihood of negative outcomes, and that protective factors are the things that we can put around folks that are associated with a lower likelihood of negative outcomes. But I also really like to help people think about this more at a population level, that this isn't a one-to-one correspondence. If you think about a scale, that if we have one particular individual and we pile on as many protective factors as possible, that is necessarily going to outweigh all of those risk factors for one particular individual. But that when we look at this at the population level, we do know that can be true, that if we are surrounding youth with as many protective factors as possible, we're looking at how we can shape the environment with those protective factors. We are tipping the scale for that population by reducing risk factors and increasing the protective factors at the same time. We are actually increasing the likelihood that they will not engage in risky behavior. We know that there are a plethora of these protective strategies, and we can look at them in several different ways. We can look at them across the socio-ecological model, moving from things that can be protective for an individual, and sort of like moving that all the way out to thinking about schools, thinking about communities, thinking about how we're changing, in the case of all of you, how you're looking at things from an entire state level. We also know that we can put them into these buckets. So we can be thinking about enforcement, how we can change the environment through laws, policies, and regulations. We can talk about education, so we're increasing awareness, knowledge, and skills. Or we can talk about engineering. So what are those changes to the physical environment? Is it, barriers somewhere? Is it reducing or increasing access to something? How are you modifying things to make safer spaces? And so there really are all of these different strategies and sort of buckets of strategies that we can look at to increase protective strategies that really have that environmental impact. And then one of the things that I was thinking about as I was putting this together is the so what. I think a lot of us that have worked in public health for a while, again, risk and protective factors, like we know this. We often, we can kind of talk in our sleep about what it is. But I really wanted to think about the nuts and bolts of the like, so what? So what do we do with this? And there actually are a lot of things that we do with this. And feel free to share in the chat if you're doing any of these things or if you have other ways that you're utilizing risk and protective factors. But you can use them to guide your strategy selection. When you're trying to figure out, what's the best fit for an evidence-based strategy, you can go and look at the evidence and say, does this reduce the risk of teen suicide? Does this reduce, bullying? What you can go and look and say, what are the risk and protective factors that the evidence shows that this strategy is reducing? And then does that make it a good fit for what I'm trying to do in this school, in this community? It also helps you focus your efforts. So when you look at data-driven decision making and looking at populations that may be most impacted by the issue that you're talking about, again, being able to look and say, well, what are the risk factors that this particular population is experiencing, and how can we look at reducing those and increasing their protective factors? There might be a particular population where you really want to focus those efforts. I also, many of you have heard me talk on partnerships. I really like to think about this when I talk about building partnership and alignment by saying, if you're looking for new partners, one of the best things that you can do is start out by saying, who's working on shared protective factors? Who's working on shared risk factors for the issue that I'm working on? And then I can use that to leverage that partnership of like, hey, we're both trying to reach this same goal. Let's try to work together. And also improving impact, because it can help inform program design. It can help you to create evaluation measures, and it can help you, again, to frame issues with potential partners and funders. We wanted to make sure, this is just a selection, but we also, speaking of data-driven decision making, we want to make sure that you were aware of some of the opportunities that you have to find data. Some of these you're able to like really drill down. You can look at things by geographic location. You can look by socioeconomic status. Looking at all of these, there is a wide array of information that is available to you. And again, you will get these copy of these slides will be posted on the CSN website, and all these links are clickable. So please feel you'll be able to get access to all of these. So don't feel like you have to be like furiously taking notes right in this moment. Thought this was a good opportunity as we're talking about risk and protective factors to remind you about our Child Safety Learning Collaborative. And one of the highlights, one of the benefits of being part of that collaborative is you get access to our most recent change packages. And our change packages do integrate risk and protective factors for each of the child safety topics and are organized across the socioecological model. They give you a menu of evidence-based change ideas and then measures that you can match up with those to see if you're making progress. And we do all of this within a quality improvement framework. So we have this, so it really is a learning community, if anyone on this call is not already part of it, where we are giving you these tools, we're giving you these resources, we're also connecting you not only with technical assistance and expertise from folks in CSN and people like Natalie from the CDC that inform and advise, also things that we're sometimes doing, but from each other as peers. And these are the change packages are available to all of our CSLC members. So, if you are not already part of the CSLC and you would like to be, we are very excited that our applications for cohort 3 will be opening in June. You can go to the CSN website to find out more information about that and how to apply. And if you are already in the CSLC, now is a great time to commit to being part of cohort 3 and continuing on the work that you have been doing. So I'm going to stop talking, and we're just going to have a brief couple of minutes here. If I'm going to, oh, I was waiting for the slides to stop sharing. I'm the one that's sharing them. I'm going to stop the slide share. And I would love to know, for all of you, how are you currently addressing risk and protective factors, or how does what I have shared so far kind of resonate with you? Feel free to unmute. Feel free to share it in the chat. Feel free to turn your video on. Are you just still thinking about all the things I just said? That you're just taking it all in? All right. Well, how about this? How about I hand it to Natalie so that you all have a time to sort of keep thinking and processing. And again, add your questions in the chat as you think of them. Also, we will have some time at the end for some sort of open questions and discussion. So if no one's got one right sort of at the tip of their tongue right now, absolutely okay. We'll keep going and then we'll pause for some again in just a bit. So, Natalie. We're going to spotlight you so everybody can see you while you're talking, and I'm going to let you go ahead and take it from here.
Great. Thank you so much, Claire Grace. Hi, everyone. I'm so glad to have the opportunity to be here with you all today. As Claire Grace mentioned before, during my time here at CDC, I have worked quite a bit on injury and violence related issues. I formerly was in the Injury Prevention Center here at CDC, had the opportunity to work with Terry, who will be talking with us later on today. And some of you, I see some familiar names in the participant list, so it's wonderful to get to connect with you all. In my former position at CDC, when I was over in the Injury Center, I worked with the Core SVIP program, what was the Core SVIP program at the time. And it was really, really wonderful and striking to me during my time in injury and working with folks through Core SVIP, how folks at the state and local level in public health are able to do a tremendous amount of work with so little. And I think, one of the most exciting things that I got to work on back then, which this slide here kind of showcases, was understanding a little bit more about what are those shared risk and protective factors that really underlie so many of the different injury, violence, and other health outcomes that we all work on to prevent. And I think that when we think about the opportunities that protective factors provide for addressing multiple different forms of injury and violence, as Claire Grace was saying, they really provide us with an opportunity to think about, how are we measuring the impact of our work more broadly? If we're focusing on this particular protective factor that we know is likely to have an impact on multiple different forms of injury and violence, how can we showcase that sort of wide-reaching impact of our work? How can we, I know we talked a lot about how can we braid our funding streams and write grants in ways that really help us show funders who oftentimes are funding things in this very siloed way, how working on this protective factor is likely to impact their outcome of interest, but then also these other outcomes of interest as well, to really make sure or really facilitate that process of braiding funding streams. So anyway, needless to say, huge protective factor nerd, and so excited to talk more about that with you all today. So, also, as Claire Grace mentioned, I currently work in the Division of Adolescent and School Health. So I am going to talk a little bit about connectedness and protective factors from a school-based setting approach, but would also love to hear from you all ideas for how you currently are working with education partners in your state and communities, or any ideas you have for increasing that work in the future. So we'll get to that in a minute. But first, If you wouldn't mind, Claire Grace, I think we can kind of click through all of these. But as Claire Grace mentioned before, we know that risk and protective factors really occur across the social ecology. So at the individual level, relationship level, and community level. Here are just sort of a few examples of those shared protective factors in particular across that social ecology. And one of the things that you might notice as you sort of look at these is that there's a common thread across individual relationship and community levels of connectedness. So at that individual level, we know that a young person's belief and feeling that they are connected and committed to school is protective against all of these different forms of violence, as well as other health outcomes that are outside of the scope of violence. For example, substance use, also academic outcomes, things that we know are adjacent to health outcomes and injury and violence outcomes, as well as direct risk or protective factors of them. At the relationship level, we know that when families feel supportive of one another and connected to one another, that's protective against all of perpetration of all of these different forms of violence. And then finally, at the community level, we know when communities have services that are more connected and coordinated for members of the community, as well as this sense of neighborhood cohesion and connection, those communities oftentimes have residents and members who are protected across these different forms of violence and other health outcomes. So again, we can see from the research that there is something about this idea of belonging and sense of connection at multiple different levels that can be really powerful for promoting health and wellness and preventing negative health outcomes and behaviors across different forms of those outcomes. The next slide. So in thinking about that, again, today I'm going to talk a little bit about one of those particular forms of connectedness, and this is school connectedness. And, as we think about school-based settings from a public health perspective, one of the really neat things about getting to work at CDC's Division of Adolescent and School Health is it's really a very sort of setting-based approach. And it's really very conducive to this idea of protective factors because within the scope of work that we really help to provide support on to local education agencies and state education agencies, we really help to address a wide variety, or are tasked with addressing a wide variety of different kinds of risky health behaviors and health outcomes. And protective factors, these shared protective factors, offer such a wonderful opportunity for schools who may be resource strapped, limited time, limited staff and resources to really address multiple different kinds of outcomes at the same time. And when we think about a public health approach to promoting health and well-being among young people, most young people under the age of 18 or 18 and below spend a vast amount of their time in school-based settings. So when we're thinking about trying to move the needle in terms of promoting health and well-being of young people, it's really difficult not to consider schools and school-based settings. They really offer a great opportunity for reaching youth and providing spaces that are promotive of health behaviors and mitigating risk for negative health outcomes. So with that in mind, I'm sorry, Claire Grace, would you mind going back to that last slide? With that in mind, one of the things just to know about when we think about school connectedness, the way that we define it is that it's, again, this sort of internally held belief that students that adults and peers in school care about their learning as well as about them as individuals. And this really includes a sense of being cared for by folks at school, being supported, and belonging. And so again, when we're thinking about connectedness as a protective factor, it's about identifying strategies and ways that we can increase this feeling among students, this sense of being cared for, supported, and belonging within school-based settings. Okay, now we're ready. So, what does the science say? So, if we do a bit of a deeper dive onto school connectedness and what we know from research on school connectedness, we know that when students report feeling more connected in school, they are less likely to engage in substance use behaviors. They're less likely to both perpetrate or be victims of various forms of violence. And they're also less likely to experience suicide and poor mental health outcomes in real time in adolescence. We also know from some longitudinal studies that these this positive effect or this protective effect also endures into adulthood. So when we look at the data long term, when people report that they felt more connected to their school in adolescence, they also are less likely to experience all of these negative health outcomes as adults. And the other thing that's interesting and worth noting is that in this particular study, which you can see the citation listed there at the bottom of the slide. The researchers also looked at family connectedness and they found very similar patterns. So again, it really sort of lends credence to this idea that there is something about this sense of connectedness that is really protective against multiple different negative health outcomes and behaviors, and that effect of connectedness can be enduring later on across the lifespan. And you can see here, this is this is the latest data that is publicly available from the Youth Risk Behavior Surveillance System. Just by a show of thumbs up, I mean, I'm guessing most folks here are familiar with YRBS. I know it looked like there were a lot of folks from state level health departments, but just to get a sense, yeah. So our 2025 data is coming soon. I don't have an exact date on that yet, but it is coming soon. But the 2023 data is the latest that we have out on our website right now. So this is based on the 2023 data. Also, a big plug, if folks aren't familiar with it already, the YRBS Explorer, which there's a link there at the bottom of the screen, I find to be a really super helpful resource. You can go in there and look at your state and look at any particular item that you're interested in. You could look at trends over time. You can compare your state's data with national averages. So just a shameless plug and shout out. Oh, thank you, Jenny, for putting the link in the chat. It's a great tool and resource. But so looking at the 2023 data, we see that just over half of students, high school students, reported that they either strongly agree or agree that they feel close to people at their school. And when you break this down a little bit, you can see that boys are more likely than girls to report feeling connected, and connectedness sort of wanes over time. So as students age and get older, their sense of connectedness tends to go down. So then, the next question is, well, okay, we know that connectedness is important. It can have all of these protective effects. What really can we do in a school-based setting to promote connectedness? What does the evidence say in terms of being able to promote connectedness? But before we dive into these two sort of example approaches that we know from the evidence, I'd love to know from folks either by coming off mute or putting it in the chat. Well, first of all, do you engage with either your state level education agencies or at the school district or even school level on health related work? And if so, what are some examples of how you engage with education agencies and schools?
So we'll stop the share here just for a minute. If anybody wants to unmute or share in the chat and talk about how you are engaging, but at what level you're engaging schools and what kinds of things you are doing with them. Shelby says she works with one of the local school districts to provide water safety education to second graders. Great. Thank you, Shelby, for sharing that.
That's great. Shelby, I have a follow-up question. Do you go and do sort of like direct like classroom teaching around that, or what does that collaboration look like?
So she actually is
Got
able
it.
to go and present the educational part.
Yeah, okay, cool.
Yeah. And I know, folks can chime in. I know that you and I talked in kind of pulling this together in that, and Terry's going to talk a lot about the kind of what they've done, extending what they've done at schools in their communities. Everyone has control of their microphones. Feel free to mute and unmute. But we know we have a lot of folks. We've got bullying prevention folks, we've got suicide prevention folks, we've got teen driving safety folks, and that there actually is a lot happening with folks partnering either with individual school districts or partnering with organizations that are then partnering with those districts. And then we've got a few folks. We just needed to give them a minute. Everybody's chiming in.
I know, I'm loving this.
Implementing heart in schools and after school programs. And Jenny's, where we'd love to hear more about what that is.
Yeah.
Jamie says the health department has a standing meeting with Department of Education to coordinate work with schools. Amazing. I bet other states that don't do that would love to. Also fund community health coalitions to work directly with schools for substance use and tobacco prevention, healthy eating and active living, sources of strength, etc. And it looks like Haley's going to share something in a minute here also. So I'm gonna start bringing the slides back up just because I know we want
Mm.
Natalie to be able to get through her last couple slides. But while that person is typing, I'm gonna see. Let's see.
Yes.
Oh yeah, Jenny's saying
That's
team for
perfect. That's perfect.
safety. Yeah,
And Terry, I
great.
see you there with your comment about how you all work with your coordinated school health committee. That's great. And presenting at their conference, that they join your statewide partner groups as well. That's really neat. Okay, awesome. So thank you for sharing some of the ways that you're currently working with education agencies in your state. I'll be talking a little bit about, again, what this looks like in the school-based settings, but then also potential opportunities for collaborating with schools to promote some of these evidence-based strategies as well. Okay, so on the next slide, a little bit more detail on positive youth development programs. Again, these are strategies, approaches, and programs that have an evidence base behind them for promoting sense of school connectedness among young people. So the first of these is mentoring programs. These are programs I think probably most folks are familiar with the idea of mentoring programs, but they really are sort of formalized relationships between adult mentors and student mentees. They can be sort of one-on-one mentor-mentee relationships. They can be group sort of setups where there's an adult mentor who works with a group of students. And really, sort of the common thread across these programs is that they're focused on providing positive adult role modeling of behaviors and life skills. They focus on providing students an opportunity to ask for guidance, to talk about the things that are affecting them in their lives, and to have a space to talk about things regarding their health, their social lives, challenges around financial struggles with their family, relationship dynamics, all of those different kinds of things. We do know that not all mentoring programs are created equal. And that those strategies that tend to be more effective are those that really find the right balance between structure and flexibility. And so mentoring programs that, for example, have a robust screening procedure or process for screening mentors, adult mentors, those that offer mentors training around effective mentorship and sort of ongoing monitoring and continuous quality improvement around that training. We also know that when there are clear and consistently reinforced expectations around mentor-mentee dynamics and strategies and approaches, those programs tend to be more effective. And one of the things worth mentioning here, so again, these are programs that can take place in the school-based setting, but as you can imagine, robust partnerships with the community, so businesses in the community, public agencies in the community, civic organizations in the community, when these really strong connections exist between the school and the larger community, that really helps the effectiveness and the sustainability of these programs, particularly in the area of being able to recruit positive mentors for students. And then when we think about, oh, I'm sorry,
I'm
Not quite
sorry.
done yet, Sarah Grace.
Sorry.
Sorry.
No, and
Oh, and I
that
see
was
we're a little over
unintentional.
time.
I was not trying to give you the hook. That was.
Yeah, no worries, no worries. So, and then just the other things to keep in mind for service learning programs, these are programs that really help to connect what students are learning in school with some sort of service to the community and ways to sort of improve their community. These are really great because they help to teach kids active critical thinking skills. They help to connect what they're learning in school with real world issues and interventions. We know they're most effective when they really help to promote understanding multiple different perspectives. And again, having robust community partnerships outside of the school-based settings are really critical for the success of these kinds of programs. And then finally, community-based programs like Boys and Girls Club, 4-H, these are other positive youth development approaches where there are strong relationships between the school and the community-based setting that really helps to drive success. And we know that all of these strategies help youth build skills, life skills. They help them engage in critical thinking. They provide positive adult role models and really help to foster a sense of purpose and being valued. And that's sort of the magic ingredients of these kinds of programs that really help to build that sense of connectedness that's so protective for youth. And then finally, one other thing that I'll mention is we have this resource on CDC's website. It's actually, I know I'm biased, one of my favorite resources because I find it to be so actionable and helpful. But this is based on a research review that we did here at CDC on effective classroom management strategies that have been shown to increase sense of school connectedness among students. So if you go to this website, we're not going to walk through it. It's really geared towards educators and folks in the school-based settings. But we know, classroom management is all about how educators create a positive environment, classroom environment that really helps kids to be engaged, that helps to prevent and mitigate any kind of behavioral issues that really get in the way of learning. And when students feel that their classroom is really well managed, they're more likely to feel connected. So if you have those school-based partners, if you're sitting on those school health advisory councils or wellness committees, if you're working with those education agencies at the state, local, or even school community level, this might be a resource that might be helpful to share with folks because on the website we do provide really sort of concrete strategies and skills and things that teachers can engage in to really promote connectedness in the classroom. Okay, and with that, I will hand it over.
Amazing. Thank you so much, Natalie. So without further ado, we're going to now shift to what this looks like, on the ground at the state level from the field. I'm really excited. We have Terry Love with us today. Many of you already know Terry, but I'm going to read just a little bit from his bio for you. He's a community leader with over 25 years of experience in community-based prevention. He's worked in multiple settings to develop leaders and motivate stakeholders to facilitate population-level change in school, community, and statewide settings. Using data, evidence-based methods, and policy, he's assisted communities with identifying, mitigating the root causes of behavioral health problems and implemented population-level change strategies. He enjoys the process of influencing change and is eager to share his knowledge with others. Terry works as the Injury Prevention Director for the Tennessee Department of Public Health with a goal of reducing multiple injuries and issues, including motor vehicle crashes, sports injury, traumatic brain injury, suicide, and adverse childhood experiences. So Terry, thank you for joining us. I'm going to stop the share, and I think we're going to have you and I highlighted. So just more of a conversation kind of format. I'd love if you could just start out by telling us about your program in Tennessee.
Well, we have a pretty big program. I'm going to focus today mainly on the one that we picked to share today through the suicide prevention effort through a CDC grant. We're implementing the Sources of Strength, and I see there's other people online who are also doing it, which is a Sources of Strength, or SOS as we call it, Upstream Evidence-Based Suicide Prevention Program. It's focused on building those protective factors that were mentioned, like connectedness to school, resilience, and then help seeking among youth, especially in rural communities, which our grant funds. And so our suicide director was supposed to join me today, couldn't be here, and there are others on this call that have had a lot to do with this success. So I can't take the credit for this work, but I do want to share it with others. So perhaps if you want to reach out to us after this call, we'd be glad to share more in detail what we've done.
I appreciate that. So what data led you to prioritize this specific focus in your work?
Well, suicide in Tennessee is a persistent public health problem for all age groups, but we've seen in Tennessee over the last 4 or 5 years an increase of about 45% of youth suicide rates, and so we've also seen sharp spikes in the ED visits and around particular times of year. And William, who our epi is on the call, he's helped track us through the Essence system. And so it made it real clear to us we need to be investing in prevention earlier and in the school-based setting and doing it. We also do some targeted efforts right around the start of the semesters.
So I think, just in reading your bio in the beginning of what you're talking, I think it's really clear why we really wanted you to speak today. But can you talk a little bit specifically about how your work connects to risk and protective factors?
Yeah, risk and protective factors sometimes can be a little overwhelming or kind of nebulous, and you're thinking, what is it exactly? What is it that people are trying to get me to do? But we have determined that the school connectedness is a key part of protective factors for youth, and some of our YRBS data also showed that, or maybe in our adult ACEs data, forgive me if I can't remember exactly, but showed that a connection to just one trusted adult can mitigate ACEs in our Tennessee population. So that, along with just the fact that this was one of the evidence-based programs that we felt was a good fit, pushed us to try to get to this protective factor, which is school connectedness.
So anything else that you want to say about, why you're really focusing in on school and community connectedness?
Well, we feel like that if the kids are supported by healthy peers and adults, they're going to be less likely to experience suicidal thoughts and more likely to seek help. They're going to be more aware of resources available to them. And and in some of these rural areas where resources can be relatively thin, to have an island of protectiveness in the school setting where they spend the majority of their time, is one of the reasons why we focused on SOS.
And you've talked both about, how you've used data to come to decisions. You've talked a little bit about some of the populations that you're serving, but what population are you really prioritizing with this work?
So I think with this work, it's rural youth in grades 6 through 12, where those accesses to services are limited and the stigma can be greater. The CDC, grant is focused in the rural areas, but we also hear this, anecdotally from our rural school folks that they need to have they need to train themselves to be able to help themselves. So that's part of the reason why we're focusing on those areas.
So what does implementation of this actually look like?
Well, it's a partnership. It has been from the very beginning, and health departments don't typically do anything by ourselves. We're always trying to Tom Sawyer folks into whitewashing the fence, and so. But we did have a substantial contract with the Tennessee Suicide Prevention Network, which opens that up to a ton of other. They have a great network in Tennessee. We're very fortunate for them to be so connected. And we've been involved with them from the very beginning. But also our Department of Education, which I mentioned in the chat, we've been partnering with them for many years through the Coordinated School Health folks. And so we really like to partner with those schools. We're also partnering with some faith-based groups and other community organizations. So it's not just limited to schools, but we're really trying to train those youth and adult advisors who then lead those peer-driven messaging and activities that, promote hope, connection, and help seeking. If Melissa was here, she'd give me a little more detail about it, and maybe the person from Maine wants to hop in and talk more about it. But it's one of those evidence-based programs. I don't want to lead people astray. It's difficult to implement. it's not just one of those plug and plays. You really have to be trained and professionally trained, and it takes a good school advisor on the ground. So, but getting a really good benefits if you have all those things in place.
So given that, hearing that this particular program does take some resources and time and energy to be able to implement it effectively, how are you building sustainability?
Well, I mean, we're one of the things is we continue to apply for the CDC money,
Mhm.
but as many people here do. But in just recently, we have trying to do some train the trainer uh, training internally, and so that way we can sustain the program here in Tennessee and build that local capacity so they can sustain and expand the program without relying on us as much. But it's again, it's an ongoing process. Sustainability is always one of those things you try to think about in the very beginning, and then you really start to think about it as the funding is starting to, it's time to reapply
Mhm.
for the funding. But I mean, I think helping the schools become self-sustaining and helping it become a cultural thing and not just a task that they have to do. I mean, if it's successful and it's working, schools will want to sustain it.
So what has your reach been so far?
As of April this year, I think we've reached over 250 youth and implemented program across 17 sites in 11 counties. And we're gonna have some additional sites opening soon. I know that sounds kind of small, but to us, it's really big to have that many sites.
Yeah.
It takes a lot of work to stand up and spread a program if you've never done this, especially a program that's as intensive as this one, and it really takes a school and or faith community and or community group uh, commitment. So we're proud of the work, and if I could show a map to you, it's all across the state. So we're also proud of that. We have 3 grand regions in Tennessee, and there are groups in each region. So we're hopeful that it'll continue to spread.
Well, and I just want to pick up on what something you just said. Tell us a little bit more about the partnerships that have been critical to your success and also how you've kind of aligned this work across different sectors.
So really, the first thing is you have to be open to partnerships, right? You have to show up at their events. You have to be at their meetings when they invite you, or find a way to get invited. And you have to develop those friendships, really, whether that's within your own department or at the Department of Mental Health, Department of Education, the Tennessee Suicide Prevention Network, and you'll never fund your way out of a problem. You'll never grant your way out of a problem or subgrant. It's going to have to be about relationships and working with people who trust you and who you can get to believe in a shared vision of what you think needs to happen. And then you have to encourage those people. You have to support those people when you can, and challenge them to do as much as they can. Again, I think it's really about showing up too. When they need help, you're there. If they need data, you get it as fast as you can. If they're writing a grant and they need a letter of support, you do it. And I know most of the people on this call already know all these things, but I can't stress partnership enough.
So I think the last question that I want to ask is just, what else do you want people to kind of take away, whether it's like a particular challenge, whether it's something that that you just want people to kind of in everything that you've said, what do you want people really to walk away with, or some successes?
Well, the thing I said in the very beginning, good staff, which we have on this call, who know what they're doing and are passionate about the work. This isn't easy work. Suicide prevention isn't easy work, and sometimes it can be mentally taxing, to look at suicide data all day long, or to talk about suicide a lot, or to create, so self-care, good staff, being
Mm.
flexible, doing those plan, do, study, act type of activities where you're, okay, this didn't work. What can we do differently? How can we make this happen? I would say, continuing to focus on trying to address the challenges, like stigma, or capacity. Those were always challenges.
Hmm.
And then identifying those local champions too. If you can get a local champion to help you with something with any of your program, whether it's suicide, motor vehicle crash, anything, if you can find a local go-getter who's already doing something special and somehow partner with them and try to meet their needs with your project, then things can sometimes really magical things can happen.
Awesome. Thank you. Well, I'm going to have you obviously, stay available. Natalie's available. Excuse me. We can shift back into gallery mode, I think. And we've got a few minutes. So, I want to point out that, Heidi from, Utah shared in the chat, some work that they've been doing if folks want to, click on that. But also, Heidi, do you want to come off mute and tell us a little bit about what you've been doing? I don't know if I can see if Heidi's still on.
Uh, It's not really my program. I just wanted to share it because it was on the topic. It's running out of our violence and injury prevention program, and we have lots of youth suicide stuff. But that one's just kind of like our big push right now. So
Thanks,
I'm not
Heidi.
really the person to speak on it with expertise, though.
But you're a great connector. So thank you for hearing it and making that connection and sharing it with this group. Thank you. Anybody have questions? Anybody want to talk about what they're doing to, risk and protective factors, promoting connectedness, any of these things? Questions? Let's see. I see the chat. Ooh, champions. Yeah. I gotta tell you, I don't know what it is about April and May, but like I know I've been on back to back to back meetings the last few days. So like no shade to anybody that's like, I just came here to listen and absorb and like totally fine. But I just wanna leave another minute if anyone did have a question or wanted to share something that you've been doing.
And I just put my
Oh,
email in the chat if people don't want to come off mute. They can email me and I can put you in touch with our great staff, anybody, and or the TSPN folks or the mental health folks or you know, we have partnerships with the Tennessee Secondary School Athletic Association, which also has a mental health person added to their medical advisory team. And we're working with them to develop some training for their coaches for mental health. So we're really trying to
amazing.
focus on that coach player relationship as a positive protective factor as well. So, there's all kinds of things we're doing. If you want to talk to us, we'd love to share and love to create conditions where bad things are less likely to happen.
Thank you. And Natalie has put her email in as well. And I will say, and Natalie, I don't know if you want to say a little bit about your ability to provide technical assistance, but even just approaching Natalie to begin with, before we had sort of like got her then to agree to come on as a presenter, I was so appreciative that as a staff at DASH at the CDC, that she was able also just to provide me with, I provide all of you with technical assistance, but I also look to people to inform my knowledge and give me technical assistance. And Natalie is one of those people. So I just wanted to give you a shout out, Natalie, for your ability to connect folks with resources. But also, if you want to say anything about folks being able to contact you and what you might be able to offer, I'd love to give you a minute to do that before we don't go away. Don't go anywhere, though, folks, because we still have evaluation and closing. So, Natalie, if you want to do that while I bring up the slides, that'd be amazing.
Sure, yes, absolutely. I think, again, we work on a wide variety of different health outcomes, including injury and violence, but specifically within school-based settings. And so if you have any thoughts, questions, ideas, really cool tools, anything related to school-based health promotion, I'm always available and happy to connect. We love hearing about what is going on, what's going well in the communities that folks are serving.
Thanks, Natalie. Well, as we're closing the discussion, I really want to give a huge thank you to Terry, to Natalie, to Melissa, who wasn't able to be here, but did a huge amount of prep connecting beforehand and putting some thoughts together. So Terry, please convey our appreciation to Melissa as well. But I really appreciate the time that went into preparing and then bringing us all this information today. I think this was really helpful. And one way that folks can let us know how helpful it was is by please filling out our brief evaluation. We've put the link both in the chat. We also have oh, my cat wants to get in the recording. We also have the QR code if it's easy just to click it. We'll give you a minute right now to go ahead and do that because we really do appreciate your feedback on how things went, what you want us to do more of, what you want us to do less of. We love when you give us ideas for future topics. I have taken on some of the planning for our STAW topics, and we'll be getting ready to create next year's calendar very soon. And so feel free to throw it in the chat now. Feel free to put it in your evaluation. Feel free to reach out to me. I'd love to know what some topics are that you would be interested in focusing on next year that are sort of cross-cutting across all of our child safety and injury prevention work. And then I absolutely encourage you to follow us on social media, and we've put those direct links in the chat. I love to say that we want CSN to really be a one-stop shop for folks because we are funded through HRSA, because we have an amazing team, especially Caitlin, who I want to thank, who's been in the background of all this today and is also our social media person. I love that when you go onto our social media, you can trust that those are evidence-based, science-based, good resources that you can feel good that if it is on our website, you can just hit the share button, share it onto your own social media. We post about a variety of topics. And so I like to basically just say that we make your life easier if you're connected with your social media at all, that you can just go on our social media and then just sort of share and re-forward all the things that Caitlin has put time into researching and doing. So I think that's about all we have. Jenny, anything that I've missed or anything that we want to do before we close?
Absolutely not. Thank you, everyone. And as Clare Grace said, these state technical assistance webinars are really designed to meet the needs of states doing injury and prevention work for children. So we do want to hear from you. We appreciate the feedback and any requests.
Yeah, and I just put my, now that I wasn't talking, because I cannot do both things at the same time, I put my email in the chat as well. So please feel free to also reach out directly if you have some thoughts. Also, I feel like all of you, most of you are state level folks, but I don't know how many of you have presented on webinars or been invited to present on webinars, but now could also be your chance. And so if you have something that you would like to talk about or present about, or have a colleague that you'd like to help them stretch and elevate their work, please feel free to reach out to me directly, because we are always looking for those topics, and then also for people that are then doing this work in your state in a community to come on and talk about what that looks like, what the challenges have been, how they've overcome them. So can't also do these webinars without hearing from all of you and your contributions. So please reach out to me. And I think we are now, look at that, 1 minute to spare. So I hope I've given everyone enough time to complete the evaluation. I give you 1 minute back to take a big, deep breath before you jump back into your day. Thanks again to Natalie and to Terry. Thank you to Caitlin and Jenny and Lauren and Maria from CSN, who've all been in the background helping out. And I hope everybody has a wonderful, wonderful rest of their day.